We have a 55-year-old woman who presents with fatigue, bone pain, and unintentional weight loss. Laboratory investigations are below. Calcium is 12.5 milligram per DL. The normal is within 8.5 to 10.5. So calcium is elevated in this patient. The patient has bone pain and unintentional weight loss. Let's check the phosphate. Phosphate is 2, and then it's below the normal. So we have hypophosphatemia and hypercalcemia. PTH levels. So here PTH is 5, below the normal range. So we have hypercalcemia, hypophosphatemia, but low serum PTH. This is a picture that looks like a hyperparathyroidism picture, but the intrinsic PTH, that's PTH produced by the body, is very low. That means the PTH is coming from outside or a metastatic condition. So which of the following is most likely cause of the hypercalcemia? So where is this coming from? Primary hyperparathyroidism? No, because primary hyperparathyroidism, even though you have a high calcium, low phosphate levels, you have a high parathyroid hormone levels. Here, parathyroid hormone levels are low. So that means it's coming from outside. It's something outside the parathyroid gland. Okay, so vitamin D intoxication. For vitamin D intoxication, may also have high calcium levels and then have a low parathyroid hormone levels, but phosphate will also go up because vitamin D actually enhances the reabsorption from the gut, and that comes with calcium and phosphate. Okay, and then hypercalcemia of malignancy. Yeah, this looks very feasible because here there's either a metastasis to the bone or production of parathyroid hormone related protein, which is not usually picked up on routine PTH test in the blood. You have to do a specific test, and it leads to high calcium reabsorption and then low serum phosphate. So it just works like PTH, like a primary hyperparathyroidism, but the PTH levels is very low. Okay, so this sounds like a correct option. Sarcoidosis. For sarcoidosis, usually there's also high calcium levels, but then it goes with vitamin D. So you may not have low phosphate levels as such. You may have high so calcium levels, high phosphate, or even normal phosphate levels. And then the PTH level will also be reduced. But then the history is not even suggestive. And that looks like a vitamin D intoxication picture. You should definitely have some high phosphate as well. But here phosphate is low. So the only feasible option here, hypercalcemia of pregnancy, is the only feasible option that we have. And the history actually supports it. A woman presents with fatigue, has bone pain, unintentional weight loss. It looks like a malignancy. So the right answer is hypercalcemia of malignancy.